Welcome to the morning show with Bill and Ryan.
Good morning.
How's it going, guys? Oh, we missed you.
Good guys. How are you?
It's been a whole week.
Jeez, and what a week it's been. Bill, where have you been over the weekend?
No, I've been in Melbourne. I actually had a good time away with family. We had a good time. And more than importantly, how was your weekend?
Look, my weekend was great. I was in Adelaide and I was fortunate enough to present at our physio conference. So the Australian Physiotherapy Association have an annual conference, and I presented some research on concussion, which I did with Macquarie University.
Oh, that's cool. And what was it? Was it a big turnout? Well, talk us a little bit about how was the conference itself?
The conference was big. It was at the Adelaide Convention Centre, and there was definitely a few thousand people there. Certainly not in my presentation, no. Probably pulled about 50 people, which is good. Bigger than your normal presentation that you do at uni. But it was great. Look, I'm not a TEDx talker. But it was a great opportunity. So yeah, I presented some research looking specifically at AFL players, concussion and subsequent injuries. But that actually leads us into the topic for today.
Yeah, so our main topic for today is hamstring strains.
Woo, woo, woo. And we wanted to talk about that actually because hamstring strains are very common in the AFL.
And you're saying that it's probably the leading injury in AFL.
Yes,
but it's not just
up there.
It's not just in AFL, but it's also in all field sports.
Correct.
It's in running athletes. It's even in walkers. Do you believe that? Walkers, uphill walkers.
I wouldn't have known that.
So I mean, it can happen to anybody. So tell me, right, what are the causes to a hamstring strain?
Well, there are many causes, okay? It can be tightness, it can be fatigue, it can be weakness, and sometimes just even the sport or the activity just predisposes some people, to have these injuries.
And what is other than the types of sports, what other demographics of types of people that tend to get these injuries? I mean, you did mention fatigue. Scratch a little bit more about it. Well, why are these athletes fatigued, and why are they getting these type of injuries?
That's a bloody good question, Bill, and I don't think I have the answer for that. Do you? Why are these players fatiguing?
Well, the thing is, most of these players are fatiguing because they are during their season. They tend to have a few knocks. They continue to play. They don't say anything to anybody, and then they, as I said, are unconditioned, and they tend to get this injury.
That sounds better than my answer.
Well, coming along, what other symptoms are getting from hamstring injuries?
So commonly when someone comes into the clinic, and this is depending on the grade of the injury. We'll go into the grades in a second. But more often they'll complain of maybe a tearing sensation or a feeling of tightness in the back of their thigh. They might have a bit of bruising or swelling, pain, or difficulty walking.
Yeah, and as what you said with those symptoms, and what Ryan was touching on was about the different grades. So there are 3 grades. We'll take on, say, like the first grade. Grade 1. Grade 1 tear tends to be, there's no bruising in the area. It feels very tight into the area. There is pain on palpation. There's too many flies here. What I mean by palpation, so it is tender to touch, and usually the time frame we're looking in is between that 2 to 4 weeks to be back to full potential of play.
Right.
What are we thinking? What's grade 2? What are your thoughts of grade 2 tears?
So grade 2 is when you might have difficulty walking, you might have reduced range, whether that's in the hip or the knee. You would have a bit more pain, okay, and not just pain with movement, but maybe even a bit of pain with rest. There's some swelling. There's maybe some bruising.
There is a lot. Actually, there is a decent amount of swelling and bruising.
Right. Yeah.
And usually, what are your time frames on the grade 2
Look, off the back of my head, maybe 4 to 6 weeks, maybe 7.
Sounds pretty reasonable.
Yeah,
sounds pretty
everyone's
reasonable.
different though, right? Right, Bill?
Yeah, that's true. And then the last one now is our grade 3. Grade 3 is something that not many people do like. They definitely can't walk on it. They have severe bruising, severe swelling.
Really, really weak.
Really weak. And at the end of the day, it is a torn muscle. It's ripped off the bone. It's not a very comfortable thing to have. And like you're looking, there is a possibility, if it's not rehabbed properly, there is a possibility that you can go down the surgical route. But as us physios, we try and help conservatively manage that so the athlete can get back to whatever sport they wanted to get back to.
100%.
And so what are some of the treatment modalities that we technically use for our hamstring strain, would you say? Starting from the basics and working our way up.
Well, I think the most basic thing that you can do for anyone is educate them. So that's everything from how we diagnose it and what the plan is, from once you leave with the physio. So when you go home, what kind of things you can do to help with the injury. Other things that the physio can do is prescribe some exercise, okay? Because the exercise can help with the healing.
Definitely.
And we certainly don't want to lose any more strength in that affected limb.
And you're right with the exercise. So research always tends to say that actual exercise of the actual limb and everything that's around the injury actually does help, and it works out a lot better than just sitting down and doing nothing about it.
100%. That's
So,
a good point.
Coming to conclude, that's everything that we're going to tell you about about the hamstring injury. But stick around, write a comment, let us know what you guys want us to talk about next week. I think we were talking about something about gardening.
Yeah, we have a lot of suggestions. Okay, so we're going to look at ways that you can garden, and not looking at the gardening per se, but looking at ways to maybe minimise your risk of injury. So looking at the back, looking at the hip and knees, and that's one idea. We have a Halloween special, which is I think going to create a lot of attention.
Definitely.
Yeah, I won't tell you what we're doing it, but it might involve pumpkin carving.
I'm excited.
Possibly.
I'm excited. All right, guys. Well, stay tuned. Take it easy, and we shall see you next week.
But